And we're back live in the studio here. The program is Viewpoint, program of personalities, politicians, and perspectives. And we have two of the three. We have a personality and perspective. His perspective would be on health and health care, and the simple matter of how we might approach health care a little better in our own homes, i.e. washing your hands, which none of us ever do, according to Hoyle, according to Mrs. Houck here. Let's go back to the your background, Mrs. Houck. How did you acquire all this great background, and where do you go to school here?
I went to Methodist Medical Center in Peoria when it was a diploma program 30-some years ago, and I've been an RN ever since. At one point early in my career, I was in Clearwater, Florida with a healthcare system who sent me to the Center for Disease Control for 2 weeks in Atlanta to train.
Okay. Yeah.
I've done other nursing positions since that time, but then 4 years ago ended back up in infection prevention.
Well, you came out of school when they dressed nurses to look like nurses.
We did. We had
Starched
caps. We worked hard for those caps.
And looked sharp.
Yes,
well,
yes.
and should you worked hard to get those.
Yes, we did.
Bestowing of a cap for a nurse was a pretty big deal.
Oh. And we spent almost every minute of school out with patients instead of in a classroom. It was a great program.
Yeah.
Well, and it's a noble profession. My gosh, it's, they say in business that if the CEO didn't have himself a really good secretary, it'd be too bad for him. Well, the same goes true in the healthcare field. The doctors are wonderful people, but the nurses are right there on the firing line. Mm-hmm. And without them, the doctor would pretty well be up the creek, wouldn't he?
Yeah, a great nurse will make a doctor's life a heck of a lot easier.
Oh, yeah.
That and the nurse techs, because they are the hands-on people. They work hard.
Mm-hmm.
Yes.
They spend so much more time with the patient, and they, and so it works out well. They work as a team, taking care of the patient and the patient's family, which is nice.
Getting back to infections and infection control, somebody pointed out to me at one point that probably one of the germiest places you run across is the banister in any place. As you go up the stairs or down the stairs, you grab hold of the banister, and so does everybody else in the known world, and they run their hand down it, and they run
Not
their
me, I
hand
just
up
opt to fall.
Oh, now that hurts. That's one of the places we don't even think about.
Well, it is, and unfortunately, because I just remember I came here from Jacksonville, Florida. I worked at Mayo Clinic, and we had several floors, and often I used the steps, and people ahead of me were using the steps, and the medical students and the residents, and everybody's going down on the handrail, hanging on to it, and there was no gel at the bottom of the stairs, and I kept asking for it, but nobody ever put any in. And then when we built this new hospital, I said, let's put gel down there at the bottom of the stairs. Well, those are considered a fire egress, for fire code. And you can't have things hanging on the walls. So we couldn't put gels at the bottom of the stairs because of that. And in fact, we have to be so careful because it's alcohol-based. You can only have so much gel per fire area. It was a real learning curve for me to learn about how much gel you could have between fire doors and those kind of things. But it'd be nice.
The regulations that are involved when you're building anything in a healthcare facility are just mind-boggling. Things that we laymen would never even think of. And if you overlook them, then you pay the piper.
And hearing you say that, and I agree with what Mrs. Houck is saying, but at some point in time, James, common sense flies out the window with some of these regulations. At some point in time. I mean, well, let's go on to another subject. I'm about ready to step up on my soapbox here. I don't want to do that.
Yeah. Well, I agree with you. I do think that some people that make the regulations haven't lived it, and therefore they haven't gone through the mechanics of what really is going on. And in theory, things sound good.
Let's just talk about the, quote, common cold. How do you know when you have the common cold, or when it's gone into something that's a respiratory infection that has to be, you have to see a physician, some kind of a bronchitis or even a pneumonia. What's the line?
Well, generally, and it depends on what other things you have going on. If you already have asthma or chronic obstructive pulmonary disease or something that's already going on, you might want to seek treatment with your physician much earlier. But the common cold, generally, it doesn't get really severe. It's annoying, you get a runny nose, stuffy head, those kind of things, but it doesn't progress into something that is so bad that you feel like you need to go see a doctor. It's just terribly annoying, and it lasts for a few days and then it's over. It's more mild, where influenza or bronchitis, those things, they hang on. You feel so much worse than with a common cold. Influenza, you often have a fever, and then often you don't. Some people never get a fever with the true flu.
But we call a lot of things the flu.
Well,
I have the flu.
We do. When I grew up, and we were sick to our stomach, or we had GI problems, my mother always called that the flu.
Right.
And until I was adult, I didn't realize that is not the flu. That is just GI distress. It's not the flu. The influenza is truly a respiratory type of affliction.
Well,
now, when you have cold or flu, those are the cold or flu virus, right?
Yes.
And antibiotics affect a virus how?
They don't.
Right.
It's a virus. You have to live it out. So you have to treat your symptoms and just live through it. And that is where I think you mentioned some of the resistant antibiotics or bugs that are resistant. That is how they believe that we've gotten to this point. People would call the doctor and say, I'd like an antibiotic, and they didn't know we were going to develop such resistance. So, they always just prescribed it. And over time, the bugs have gotten resistant to many of those common antibiotics.
Now we've got superbugs.
We have superbugs.
Yeah.
Is there an asset in drinking water regularly? They say 7 to 8 glasses a day. About safe to say most of us don't do that. Some probably practice it religiously, but most of us go on about our way, and if we get 2 or 3, it'd be a big thing.
Right.
If you're beginning to have symptoms such as you've just described here, help yourself by starting to make sure you ingest more water.
Well, I think you don't want to get dehydrated, that's for sure. So I don't know that water will
not going to cure it,
but it can't hurt. You don't want to get dehydrated. And the more water you drink, it keeps those secretions in your lungs more liquefied, so you can get rid of those. And I think I'm a strong advocate of water. So.
What about vitamins? A growing segment of the population is self-medicating. Now that the cold and flu season, for instance, is here, take a lot of vitamin C. Take just a gang of it. And they take a vitamin for this and a vitamin for that. And then there are other things that aren't called vitamins. They're just pills full of something else. Fish oil and things.
Panaceas.
Little treats.
Well,
What about this business about I'm going to keep myself healthy, I take 18 vitamins a day?
again, I think your physician should help you decide. There's so many studies out there of what works and what doesn't, and then you have to consider we're all unique individuals, so we're all going to respond differently, you know, to things. Now, I can tell you when I worked at Mayo, I worked throughout the hospital, and one unit was a liver transplant unit, and there was a woman there, a young woman, who had aches and pains and been depressed, and nobody could figure out, she felt, that quick enough what was wrong with her, and she started taking an herbal supplement, and she took it a lot, and next thing you know, her liver just quit. It shut down. And so she was on the transplant list just because of an herbal supplement. So just because they're herbal, you've got to be so careful. And you know, the home remedies, I mean, my mom always had us gargle with salt water and we had a sore throat, and it works. And it still works. You know, things like that I think are harmless, and if things make you feel better in moderation, I think that's okay. But when you start taking extra things, I think discussing it with your physician is your best bet, you know.
Well, you walk in any drugstore or bigger store such as CVS, Walmart, Walgreens, whatever, wherever you find, and you walk past these shelves and a row on row on row of these various self-medications and vitamins and so forth, and you shake your head and say, boy, this is really big business, and it is huge business.
It is. It's overwhelming.
Now, let me ask you this. Some folks take Centrum, or some folks take fish oil, some take calcium on a daily basis. They certainly can't help, or can't hurt, I mean.
No, I don't think so, especially the calcium. I know that my doctor is always on me to take more calcium or take a certain level of calcium because of women and osteoporosis. And I think as we get older, our body just doesn't have some of those things. So,
But don't men get osteoporosis too?
well, they do. They do.
Why don't they take calcium?
You know, I'm not. I don't know. I don't know if their doctors tell them to take it or not. I honestly don't know. I'm not a vitamin expert, but I do know that for women, I think we lose it quicker because of, you know, childbirth and hormones and all that other stuff. So,
But it's not good to just go into the health store and have one of each.
I don't think it is.
Yeah.
I would talk to my doctor first.
Oh, my gosh, yes, that's common sense, isn't it,
yeah.
huh? Really?
One more thing I'd like to say about that, because we have the internet. The internet is
Please.
a wonderful vehicle, but it is also terribly dangerous. And I've had people in my life that I've called armchair physicians because they get in front of the internet and they believe everything they read. They don't look for a credible source. If you're going to get on the internet and read about things, it needs to be from a credible source, a university that has a medical school that does research, or, you know, some of our leading healthcare institutions. You know, these blogs and things like that, they're fun, but you have to take a lot of that with a grain of salt. You can't just believe everything you read on the internet.
How many years have you studied? How many years has any of the doctors in the area studied?
Right.
And we all know people who go to the internet and they are a doctor. I mean, you can be a doctor in 2 weeks. And it really doesn't quite cut it.
No.
Yeah, that's as dangerous as I've known a couple of fellows here recently found email pretty dangerous business, so you have to be careful.
Well, absolutely.
Now, there are many good things out there in the internet world,
Yes.
but you just have to be very, very, very careful about accepting everything at face value.
Right. Doesn't take the place of your family
If you have any
physician.
questions at all about anything, it's your doctor's job to advise you.
That's exactly right.
Unfortunately, the practice of medicine has changed so radically down through the years that it's almost, it's tough to get a doctor to talk to on the telephone. That just doesn't happen today.
Yeah, it's different.
Heretofore, say, Doc, I got this, what do you recommend? Well, that doesn't go on today.
No, and I have a friend who retired from nursing. She was in the nursing field for years and years, and shortly thereafter, another friend asked her for advice, and she said, I wouldn't dare say anything because the field of medicine changes so radically and so rapidly that you have to be immersed in it in order to know what is the cutting edge. You can't say a year later to a person, gosh, I think that what we would do is this, because it's probably not the thing anymore. Is it ever kind of a concern to you that people can keep up with all this? I know continuing education is demanded, but it's a big deal.
Oh, it's a huge deal. But I think more and more emphasis, even in our own walls at ALMH and within any healthcare system, is evidence-based practice. So we're starting to question things that we learned years ago that everybody thought might be, good for you. We're starting to question some of those things by looking at true evidence now. So having evidence-based practice instead of just saying, well, that's the way we've always done it. And I think that's so important. But yeah, I think it is hard to keep up, but with the Illinois, just within the past couple of years, have started requiring their nurses to have continuing education credits, so many per licensure, which is every 2 years. I know the physicians have the medical education credits that they're required to do, and I think if people choose wisely for those instead of just knocking them out, just so they can renew their license, I think they're going to, keep up with what's their specialty is.
Right. Another vaccine that seems to be growing in popularity is the shingles vaccine. And for a while there, Medicare, for instance, didn't pay for it. And now I understand they do. What about that shingles vaccine? What would be your professional opinion on people availing themselves of it? I haven't had it. Have you?
When I was a young boy, I mean, like before teenage, I had shingles. And the treatment at that time was I took a cotton swab and painted it with collodion.
Whatever that is.
Yeah, well, collodion was...
Is that like an accordion?
Yeah. Well, you squeeze it very carefully. Yeah. Anyway, and I don't remember taking anything, but they painted it. I think that was trying to keep me from itching or whatever. But,
Wow, that's unusual as a child to have shingles. I mean, you have chicken pox. But the vaccine, again, that would be something you discuss with your physician. But the way I understand it, shingles is a very painful disease. And again, if a vaccine can prevent you from going through that in your later years, I would recommend it. But I would talk to my physician.
But you have to have had the chicken pox at some point in your life, and that virus then is still in your body, and then you get the shingles at some time after your chicken pox episode.
I can't really speak to that because I don't know exactly for sure.
the doctor just withdrew her shingle.
Yeah, that's it.
Oh, that's terrible. That was really bad. Other than being very uncomfortable, the shingles have no particular life-threatening effects, do they? Or does it? Whatever the question is.
Not that I know of, unless unless they involved organs versus your nerve tracts. Normally they run along the nerve tracts, and they get inflamed. And
Well, there again, thanks to television and the e-age and the ambulance chasers that are out there on TV with advertising and so forth, you're led to believe that shingles could be a horrendous thing, and it may be for somebody who's suffering as far as actual physical comfort's concerned, but it's not a life-threatening thing. We've seen these ads that, well, in any event. By the way, we've almost expired our time, speaking of expiration. We always try to close with a quote, and knowing you were going to be with us with the subject matter, I found something. Mark Twain, Samuel Langhorne Clemens said, "Be careful about reading health books. You may die of a misprint." Thank you for Viewpoint.